Hello guys, how are you? Hello wonderful people, how are you? I know I keep on calling you wonderful people, but it's because you're really wonderful and I appreciate you so much. So welcome back to my YouTube channel. My name is Betty Ndusa, and for those who might be new here, my channel is Binti Afya Kenya, and all we talk about is women's health in Kenya. We talk about also other issues that are affecting other the general population in the world and also in Kenya. Thank you so much for the love that you give me for my previous video that I did on domestic violence definition and also the forms of domestic violence. If you haven't watched it, make sure that you've watched it. So before we dive into this topic today, I thought it's good that we highlight the risk factors of domestic violence. And before we even talk about the risk factors, I need to put this disclaimer, and say that there's no amount of, there's nothing that can justify any form of violence. Someone who is, committing any form of violence against women, there's nothing that can actually, justify the reason why they are doing whatever it is that they are doing. So what are the risk factors for domestic violence? Having talked about all those things, so this desire for control, as I talked about, I remember I explained to you about what is domestic violence, and basically it's about, your intimate partner wanting to gain control over you. And this desire for control may come from, anger management issues, self-esteem or jealousy, an inferiority complex, personality disorders, learned behavior, as well as alcohol and substance abuse. So those are some of the things for desire, to be able to, feel like you want to control someone. So what are the main risk factors, for development of this dangerous control behavior? There's lower education levels, childhood abuse, there's drug and alcohol abuse, there's men who view women as inferior, there's also growing up in an abusive environment, females who witness domestic violence as children. So I think it was I thought it's good that you highlight some of the risk factors so that as you're trying to understand why is this happening to me, you might, or why is my partner doing whatever it is that you're doing to you. It could be stemmed from way back, or from their childhood experience, or habits that they experienced as a child. It could be even a mental disorder. It could be that it's just they're not well sort of educated to be able to realize that there are better ways of handling conflicts or any other form of disagreement in a family setup that does not necessarily involve violence. So as I highlighted earlier on at the start of the video, these issues of domestic violence or violence against women have really been rampant during this COVID-19 era. And solely because there are a lot of disruption of system that happened when COVID-19 hit us last year in March 2020. So you found that children who are going to school were told that you can't go back to school. You have to learn from home. There's also women who had businesses, or even men. Their businesses were closed. Maybe the kibandas that were around a certain area. Or even, the doctors, a lot of, systems were really disrupted, and people were even afraid of even going to the hospitals, So, and that's why I talked about, the disruption of systems. So basically, these issues of lockdown and disruption of system have actually aggravated the issues of violence against women, and solely because, going to school was a form of refuge, or a place of, a place whereby you feel safe as a girl, and you're not able to go there anymore. You sort of feel like, helpless, and you're not even able to find the help that you need. And now that you're in the same house that, your abuser is, you're sharing your house with the same abuser, it sort of aggravates the level of, risk that you have as a person. Even for women who had businesses, not only younger girls, even women who had their own businesses going on, and now you have to depend on your husband, who is sort of abusive. And if you have to depend on them and they want to feel in control, then it's even hard for you to be able even to report these things when they happen. So I think as much as there's a lot that happened with these lockdowns and all those things, I think there had to be a system of whereby you can call someone, or there's a way that you can actually report these cases. And I think I'm going to highlight that earlier on, or rather later on the video as we go on. Okay, so what is the data that is connected to violence against women during COVID-19? So we find that more than half of the women, in a survey that was done in 2021 by UN Women organization, more than half of the women surveyed reported that they have or they know a woman who has experienced physical violence and verbal violence during COVID-19, or rather that era of COVID-19. Then you find that in Kenya, 1 in 5 women reported feeling unsafe in their household in the last 6 months. That was reported in Kenya, and that's this form of fear, or not being able to actually control or be able to find help, whatever it is that you have. It's sort of a very risky place to be. And some of these things that you might actually experience is a form of physical abuse, as you're going to talk about them earlier on. You find that there are so many people who had actually been experiencing them before this survey was done, and they're not even aware about it. So now that you've been able to put this issue into context, I think it's good that you highlight. So what are the forms of physical abuse, and how can you actually realize that your partner is physically abusing you, and what are the forms of physical abuse, and how can you actually get help as a person if you're undergoing such kind of abuse. So physical abuse involves hurting or trying to hurt a partner by eating, kicking, burning, grabbing, pinching, shoving, slapping, hair pulling, biting, denying medical care, or forcing alcohol or drug abuse, or using physical force. So you may be in a physically abusive relationship if your partner does these things, that is, damages property when angry, throws object or punches the wall, or kicks the doors. I'm sure you've heard this song, Dodge Sahani. Yeah, so yeah, basically that's one of the forms of physical abuse. And then pushing, slapping, biting, kicking, or choking. Then abandons you in a dangerous or unfamiliar place. That is one of the things that you can actually realize that you're in an abusive relationship with your partner does such a thing. Then scares you by driving recklessly. Uses a weapon to threaten or hurt you. This weapon could be a knife, it could be a scissors, a very sharp scissors, it could be a gun, it could be anything, any weapon that is quite scary for you. Then forces you to leave your home, traps you in your home, or keeps you from leaving wherever it is that you are, or you're in the same setup with them. They're trying defending you, or sort of preventing you from leaving wherever it is that you are. Then prevents you from calling police or seeking medical attention. Then hurts your children. Physical violence is not only for the adults, even children actually experience physical abuse. Then uses a physical force in sexual situation. Of course, this is rape, and it's one of the forms of physical abuse. So those are some of the things that you can actually realize, you're going through physical abuse. And there are so many other, forms of physical abuse. I'm sure I might not have exhausted everything. Some of them include even withholding physical needs such as sleep or food, refusing to release necessities, that is medication, or locking the victim in the house, withholding the help, or just basically preventing you from seeking help. So those are some of the forms of physical abuse. And maybe just to recap about it, it's more of physical things that, you know, cause injury to you on your body. And this could be, you know, physically injuring you with a weapon, or kicking, choking, all of those things. I think it's easier for us to be able to recognize physical abuse as a form of violence against women. Other forms might be quite hard for you to understand, but physical abuse is quite, you know, very rampant, and you can actually realize when you're undergoing through it. I think it's good that, you know, if you know of any case of physical abuse or any form of domestic violence as a physical that involve physical abuse, you can actually comment on the comments down below. Yeah, you know, I'm sure these are things that you've actually had, you know, in Kenya. And very recently there's this doctor that actually, you know, killed the children and killed himself. You know, that's a form of suicide. And there's a video I did on suicide prevention. Make sure that you've searched on my channel. I can even link it up on this video. So I think it has been a good video, and before we finish, maybe we can highlight, you know, what are some of the things that the government is doing to be able to help these people or women in Kenya. So just to highlight, there was a ceremony that was in Paris, and that's in July 1st of July 2021, and our President Uhuru Kenyatta attended the conference. And one of the commitments that he made during his speech was ending violence against women and girls, including building a strong data and evidence to inform policies and programs. So in particular, he committed to inserting a gender-based violence module in the upcoming 2022 Demographic and Health Survey to strengthen the utilization of gender statistics and inform the design and scale up of evaluation of FGM and gender-based violence programs. So basically there is a program or rather a module that has been inserted in demographic and health survey to strengthen utilization of gender statistics, basically to get the data and to be able to inform them in making policies and implementing policies against violence for women and also gender-based issues, that is including FGM. Then of course I mentioned in my first video on domestic violence, actually I included some of the helpline that you can call. There's also a group that I know, it's called Usikimye. It's on Facebook. You can just Google them, but I'm going to link them on the description box. So just a disclaimer, this video is not supported by any of the organization I might have mentioned during the video. But I thought, you know, as I always say, it's good to share information. If you have it, it might help someone out there. So thank you so much for the love that you show me on my YouTube channel. Continue subscribing, continue commenting, and you know, let's reach a lot of people, you know, with this information on gender-based violence, and let's reduce the numbers and make sure that, you know, our women are living healthy lives. And above everything else, be kind, be generous, and make sure that you help someone who might need this information. Share with them and help them to be able to get out of that, you know, that bad, or rather a very, you know, depressing moment in their life. So just to highlight that you're going to have World Mental Health Day on 10th of October. That is coming next week on Sunday. So I'm going to have a very special video for you guys. So make sure that you stay tuned in and subscribe to get the special video once it's released. Thank you so much and have a lovely day or afternoon or evening, wherever it is that you're watching me from. Bye.